I'm Dr. Cassi from NABC's Vetfolio and the host of Vet2Vet. In the last few years, the general awareness of all things vaccines has really increased, and the speed at which new vaccine technologies are entering the market is incredible. And it's incredibly important for veterinary practitioners to understand the science. To make informed decisions for our clinics and be able to communicate with clients is crucial. Joining us today is Dr. Rich Ford. Dr. Ford is a co-author of both the American Animal Hospital Association Canine Vaccine Guidelines and the American Association of Feline Practitioners Feline Vaccine Guidelines. He frequently gives continuing education seminars to veterinarians on infectious diseases and immunization. He's published more than 200 papers and textbook chapters pertaining to infectious disease in companion animals. Dr. Ford, thank you so much for joining us today.
Well, thanks, Cassie. I really appreciate the invitation.
Absolutely. We're glad to have you here. All right, first question. For veterinarians who are engaged in companion animal practice, the vaccine market has been and continues to be pretty dynamic. So as a co-author of previous canine and feline vaccine guidelines, what are some of the major changes that you've observed?
Well, Cassie, it's a good question. And there are three primary factors that I see. Number one are the guidelines themselves. We introduced them in the late 1990s and then the early 2000s with the canine vaccine guidelines. And very quickly, they gained international acceptance. It was filling a need. And today, I think the majority of practitioners, certainly in North America, follow these guidelines at least in part. So that's had a huge impact on the selection and use of vaccines. Then the other factor is in the dynamic equation, the sheer number of vaccines on the market today. Cassie, I just counted this up. There's about 120 vaccines for the dog. And this represents somewhere around 30 antigens that the USDA has granted a license for. For the cat alone, we're looking at almost 75 vaccines by trade name. So the menu for the individual practitioner is almost 200 vaccines for dog and cat. So you can see the market is huge. So the question is, which one do I use and why would I use the one I select? And then on top of that, I find that owner awareness of things vaccine has accelerated, probably attributable to the COVID-19 pandemic. I mean, you hear more people concerned, more people hesitant about vaccines. And in fact, we know this is spilling over, if you will, into veterinary medicine as clients are asking veterinarians, does my dog or my cat really need this vaccine? What is it potentially harmful? Is it necessary actually to give this vaccine? So we're seeing these kinds of responses. And then, Cassie, if you overlay all of that, what's really adding to the dynamics of the market is actually the vaccines that I think many of the people viewing this today will remember things like the ringworm vaccine. It came and it went. Same thing with the porphyromonas vaccine, the gingivitis vaccine. It came and it went. And then on top of that, there are vaccines currently on the market for which those of us who write guidelines do not recommend their use. And for example, it would be certainly the canine coronavirus vaccine, the FIP vaccine for cats. They're licensed, they're available, but they have not shown reliable efficacy and value in the market. So we simply don't recommend those. And then even more so, there's the H3N8 canine influenza virus vaccine. That's still being used extensively throughout the United States. And the surveillance on that has clearly shown that H3N8, which emerged in about 2005, has self-eradicated in the United States. It hasn't been diagnosed or confirmed in years. So all of that together adds to the complexity or the dynamics of this vaccine market faced by the practicing veterinarian.
When you mentioned the number of vaccines available for use in dogs and cats, are you referring to new vaccines for new diseases or new vaccines for existing diseases?
Well, that's a bit of a complex question because it's actually both, Cassie. And I think a lot of the practitioners watching this today will remember some of the emerging diseases. We can go back to the 1970s when feline leukemia virus came onto the scene as a truly new infection in cats. And then in the late 70s, canine parvovirus emerged as a truly new disease and became very quickly a pandemic that went around the world, infecting and killing millions of dogs. That resulted in a new vaccine in the early 1980s. And then more recently, of course, the two strains of canine influenza virus, the H3N8, which emerged in 2005, pretty much eliminated by now. And then there's the H3N2 variant, which is really a minor disease today, but has been circulating in the US as a new infection, at least for US veterinarians. So, yeah, those are out there. But I think the real significant changes come in the emerging technology for existing diseases. And I think it's important, Cassie, to remember a couple of things now. If you look at these 120 or so or vaccines that I've listed for the dog and the cat, the almost 200 menu items for vaccines today. Think about the fact that for canine distemper alone, there are two different technologies of vaccine to choose from. Which one would you pick? For something like feline leukemia virus, there are three different technologies that are available for that, three different technologies for Bordetella bronchoseptica. And then for Lyme disease, for those of you who are using Lyme vaccines, there are four different types of vaccine available today. So you see how that adds to the complexity of selecting and using vaccines in practice today.
I'm really glad that we're having this conversation because I feel okay in my ability to explain the different diseases to owners and what their pet might be at risk for and might not be at
Yeah.
risk for. But man, we're getting into some complex stuff here, and I'm really looking forward to diving into this a little bit more. So, talking about this technology, the technology differences among vaccines, what specifically are you referring to with those?
Well, this is where I think some of this discussion can get a little challenging. But consider this, Cassie. I'm in the grocery store. I'm in the produce section, overhearing a conversation of two ladies, and they're talking about mRNA vaccines and viral variants. Now, I can assure you that 2-3 years ago in the produce section of the grocery store, you did not hear that level of conversation. So things vaccine have really come to the fore, I think, in the discussion. Obviously, the pandemic has contributed significantly to all of that. So my approach in the lectures I'm giving today tend to focus on the technologies that are available and why you would use one technology for the same antigen over another. And the simplest and oldest class of type of vaccine would be killed. They're very easy. Bacterial and viral antigens are inactivated, they're dead. And because those, in and of themselves, are very poor antigens, they have to add a chemical to it. And this is referred to as an adjuvant. That is the proprietary stuff in the killed vaccine conglomerate. And there are lots of proteins in those killed vaccines. And because those antigens are dead, adjuvant is necessary. Adjuvant creates an inflammatory response, and that inflammatory response signals the immune system to actually find the antigen. Well, the next biggest improvement in vaccine technology we use today are, of course, the modified live viral vaccines. And these are not adjuvanted. They don't need an adjuvant because they actually infect, if you will, the patient. These are living viruses or bacteria. And as a result of that, they infect cells, they replicate in the patient. A small quantity of antigen is capable of actually inducing a robust immune response because of that ability of the antigen to replicate. Now, it was 30 years ago, just over that, Marielle had introduced the first recombinant technology in the form of the Recombitech canine Stemper vaccine. This is a truly recombinant vaccine. By analogy, it's similar in its construct to the Johnson & Johnson coronavirus vaccine that's available for COVID-19. And in this case, rather than actually injecting the antigen, you're injecting the genetic code that after injection expresses the antigen, provoking antibody production. And there are some real key advantages to that technology in the high-risk population, for example, of shelter medicine, where dogs actually enjoy earlier immunization compared to modified live vaccines because the recombinant technology doesn't or isn't recognized by maternal antibody. Therefore, the vaccine will provide earlier protection when you compare it head to head with modified live vaccines. Then we do see in veterinary medicine another form of genetic vaccines, the raw or naked DNA vaccines. These are available and licensed for use in veterinary medicine. These are niche vaccines. These are not designed to prevent disease. These are designed to actually treat disease. And by that, we're saying we're injecting DNA that expresses an antigen for which the antibody is targeting one of the metabolic pathways in the formation of tumor. So these are actually used in oncology frequently and sold pretty much exclusively to the specialists in oncology and internal medicine. But then, Cassie, on top of all of those four labels of technology, you have what I find interesting are alternative routes of administration for the different antigens. And certainly we've had sub-Q and intramuscular, but more recently have been introduced, as everyone knows, the intranasal vaccines, and now more recently, the orally administered vaccines. So mucosal immunity is kind of taking front and center for certain antigens.
It would seem that today there's kind of a blend of older and newer vaccine technologies available, which sort of begs the question, what distinguishes one vaccine from another if they both offer protection against the
Yeah.
same virus or the same bacteria?
Cassie, you're spot on. I think that's ultimately the kind of $64 question. Let me default just a second to the licensing of vaccines. And you've all heard this. It's actually, I think, becoming a little bit trite today in the promotion of the COVID vaccines. We've all heard this. These vaccines, when they hit the market, are, quote, safe and effective. That's used over and over in the marketing and promotion of these vaccines. Well, let me be clear on this. The terms safe and effective have very, very distinct meanings to the FDA, who licenses vaccines in human medicine. And the same terminology, safe and effective, is applied by the USDA, who licenses all animal health vaccines. So what does it really mean? While it has very, very distinct meaning to the licensing agency, to the veterinarian and the general public, I think it has a slightly different meaning, because I think practitioners today all know that these vaccines are not 100% safe, neither are they effective 100% of the time. And that's biology. So the terms safe and effective have different meanings here. And I bring that up because that's used in promoting and marketing vaccines and convincing the public that they are in fact necessary. But here, let's do a little bit of a deep dive on efficacy. We're talking today about efficacy issues that using newer technologies bring a lot more to the table than before. For example, I mentioned this earlier, the recombinant distemper vaccine. This is the Recombitech distemper product that actually, by virtue of its nature, is not recognized by maternal antibody. And in so doing, will provide targeted immunity against a really high risk population. So it brings value to that arena. So that's a really important point. And I like the term targeted because it is a very specific antibody targeting a piece of that infectious agent to prevent infection. And by analogy, you could also look at the recombinant Lyme vaccine. Rather than injecting a whole bacteria, really Burgdorferi, in order to get one antigen on many antigens associated with that vaccine, the whole cell vaccines bring issues with reactions. And I think this can be largely avoided with the role of the recombinant technology, which is just targeting that specific antigen, the outer surface protein A, with the immune response. It's cleaner, it's less reactive, and it's, in essence, a very targeted approach. And then on the other side of the fact of this equation is the safety factor. And this is really important, I find, for veterinarians. Efficacy is a little bit more difficult to measure in practice, depending on the disease prevalence. But safety is something that veterinarians see as far as reactions at the time of vaccination. How well does the dog and the client accept the fact that when the dog got the vaccine, they didn't react to it? Those are important variables. And I think the fact that recombinant technology in and of itself is a cleaner technology, it has less protein, less potential for reactogenicity, less likelihood of adverse reactions, is a very important aspect of the advanced technologies. I think when it comes to feline vaccines, you look at the PureVax line of vaccines, which do not contain adjuvant. They are adjuvant free. And as a result of that, as the body of science supports, adjuvant chronic inflammation in some, not all, but in some cats, can lead to tumor formation. The bottom line, removing that adjuvant from a line of feline vaccines, I think is really a critical move on behalf of our profession for the patients that we're vaccinating.
Absolutely. I mean, I think safety is one of our number one consideration when we're using these in practice because, of course, we're making the recommendation. We're saying, yes, you should give this vaccine. So the last thing we want would be for anyone to have a negative reaction to it. But as we know, it happens from time to time. So being as safe as possible and feeling like you did everything you can to keep that animal safe is important. So you may have touched on this a little bit, but I'm curious if we're using a certain type of vaccine in practice, we've used it and we feel good about it, why change? What are the compelling reasons to change from a vaccine that utilizes older technology to one that utilizes different, newer technology if, this is the vaccine I've always used and I'm not having a problem, so to speak?
Well, Cassie, now you're asking harder questions. And I think from a personal perspective, having watched the evolution of veterinary vaccines for several years, what I see with the newer technology vaccines, particularly in the context of the recombinant vaccines, is a lot more sophisticated science that goes into the production and manufacturing of these products. There is so much really fascinating research behind the development of these vaccines. The recombinant technology is actually quite fascinating to watch that evolve. But it's interesting that you bring this up because from the practitioner's perspective, you know, vaccine technology is really difficult to appreciate. And this is particularly true when the incidence of a disease may be low. For example, if I'm vaccinating dogs in Colorado with sterile saline, I don't see Lyme disease. So sterile saline is highly effective against Lyme disease in Colorado, where they have no naturally occurring Lyme disease. So it makes sense. It works well. But if you take, for example, the Recombinant canine distemper vaccine, in most practices, there's probably not a lot of distemper encountered. It's difficult to appreciate how that advanced technology benefits individual patients. But then look at the high risk patient. You move into shelter medicine, on the other hand. This is a completely different environment where the risk for canine distemper is very real. And the recombinant vaccine technology does bring something to the table that's very objective, and that's early immunization of the young dog. And Cassie, I will say that in my experience, that there's a tendency for the profession to kind of revert to commoditization of vaccines. And it really comes down to the lower price is the better, is what I'm going to select. And the objective, I think, based on our conversation, is to reconsider the technology that's involved. What is the science actually behind these vaccines that we're using, and why has that science emerged? It's for a reason.
I think that's a really important consideration because, while sure, I haven't seen very many vaccine reactions for the number of vaccines I've administered, the feeling of wanting to know that you really did your best to select the safest and the most effective option for that patient is so important when you get those rare cases. So I agree with you, thinking about the different technologies and what really is going to provide the best protection for your patient all around.
Well, what do these vaccines really bring to the table? We've talked about this throughout this discussion today, but I think the real value added comes in these vaccines. The newer technologies offer less reactogenicity, less likelihood of adverse reactions, and a really targeted immune response. And I think a good example is comparing the three different kinds of feline leukemia virus vaccine that are out there today. This is recommended for all kittens. This is the high risk cat, is the young cat, and this is the target population. But the killed vaccines, the inactivated vaccines, are whole virus, and they have with them adjuvant, they have with them preservatives. Included in the mix are part of the culture medium itself. All of these proteins combined tend to enhance or add to the reactogenicity of these vaccines. But when you get into the recombinant technology, a lot of that is eliminated. And you've selected the specific gene that encodes for the specific protein that makes the antibody for that part of the virus that will prevent infection and attachment of the virus itself. So you see, we're really like the coronavirus vaccines. They are targeting the spike protein. Well, the recombinant vaccines in veterinary medicine are doing exactly the same thing. They're targeting a very specific part of that viral antigen or the bacteria that induce the infection. And as a result of that, we see higher efficacy overall, and we see significantly greater safety.
So, Dr. Ford, I'm so glad you're here because you're just doing such a good job of really driving this information home and showing the value of considering what type of vaccine you're using for what population and what reason, what antigen, all of this. So, with that in mind, if you were to look into your crystal ball at the future of vaccine technology in veterinary medicine, what do you see up next? Where do you see this going?
Well, it's fun to kind of philosophize on this, Cassie, but I think it is real that molecular technology, recombinant vaccines are on the forefront of advancement. We're able to discretely identify the genes or the genetic code that expresses or encodes for the antigen. And that provides, obviously, as we've talked about, a more targeted approach. But when you look at the big picture, when I look in my crystal ball, what I'm seeing is advancements in routes of administration. I see different approaches to administering vaccines, such as mucosal or transcutaneous vaccines. Very effective ways of delivering these molecular antigens. So it's an interesting opportunity as we look forward. And the other thing, Cassie and I just picked up on this morning. Have you heard there is a type D influenza virus that's infecting livestock, pigs, sheep, cattle, and the people who handle these have shown infecting levels of antibody. In other words, they have been exposed and infected. So I think in the crystal ball scenario, and to address your first question about the dynamics of this vaccine arena that we work in, is going to continue. We see new diseases emerging, and the new vaccine technologies, I think, are done just for that reason, to address potential for doing a better job with existing disease, but importantly, for emerging diseases that we know are circulating in the environment today.
Gosh, no, I had not heard about the influenza D, and as terrifying as it is, we know that influenza is one of those that we always have to be on the lookout for. So
That's true.
very exciting to know, about all the different technologies, different routes of administration, which can increase the percentage of the population that is vaccinated, both for diseases that we've dealt with for a long time and continue to deal with, and these scarier emerging pathogens that we've seen and probably will continue to see. So Dr. Ford, I can't thank you enough for joining us today and going over all of this. I know that I learned a whole lot from this talk, so I really appreciate all of your insight and information.
Well, thanks, Cassie. I enjoyed talking with you about this.
And thank you to Boehringer Ingelheim for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.